All right, good evening. Good evening. You're welcome to today's class. Today we'll take a look at pharmaceutical calculations. Okay. You sent some. What did you say we should start with? Or do I start from anywhere I want? What did you send to me?
I say 6 people. Anywhere you want, we can start.
Should it be a question oriented? It's still not topic by topic. Question oriented. Okay, that's why I was like, why are you coming now? Why didn't you start from the beginning of the semester when you know that you have issues to discuss? Why didn't you come on time?
For the first one, the first one that one is not my problem.
Okay. Then you sent dosage calculations, right?
Yes, sir.
So let's pick some questions in dosage calculations and see how far you can go there. So we answer one or two questions from there, then we'll move to the next topic. I think that is the best thing to do in this situation. Let me look for questions in dosage calculations. Then write it down, then we'll solve it. Okay, question number 1. Okay, so let's look at this question. This question is from dosage calculation. It says 500 ml of heparin is to be given over 10 hours. full stop. The tube inside delivers 10 drops per ml. How many drops per minute are being delivered to the patient? If you look at this question talks about the rates, drip rates, all together, drip rates. So the heparin is 500 ml to be given over 10 hours. Over 10 hours. Now this to be side now, this is the drip set used. Am I communicating? This drip set can only deliver 10 ml, 10 drops per ml. What means is that 1 ml will bear 10 drops. Now the question now says, how many drops per minute are being delivered to the patient? Now to calculate this, the first thing you should know is that solution. Note here that 500 ml is delivered over what? 10 hours. That 500 ml is delivered over what? 10 hours. $500 ml is delivered over 10 hours. But 1 ml, this to be side now, this set, 1 ml of it, 1 ml of this set, 1 ml from this set will bear 10 drops. 1 ml will contain 10 drops. So let's move this 500 ml to drops. Let's see how many drops will be in this 500 ml. Altogether, if 1 ml will bear 10 drops, using that drip set, how many ml will be what? 500. So if you know how many ml, so how many drops will be in 500, we can solve this question. Are you following? Are you following? So, for us to do that, we keep this one aside. For us to do that, we say, we come here and set a proportion with this. That 1 ml bears what? 10 what? Drops. Altogether. So 500 ml using this drip set now. 500 ml will now be how many drops? We don't call it what?
X.
So let's find this x. X is now equal to what? We cross multiply. Tell me x is now equal to what?
X is equals to, if you cross multiply.
Yeah, tell me now.
X is equals to 1 mil.
1 may have. So tell me what will happen when you multiply. These are the issues.
It will be okay when you multiply it will be 1 mil.
Make x insert the formula.
Make x equals then 1 mil. When x is subject of the formula,
yes,
then it will be equals to 1 mil.
This is the problem. So up to now you don't know how to do it. Do it fast. Do it fast and tell me. This is where you should write now. If you cannot do this, that means you can, even if I give you an example now, you can never get the answer.
It's equal to 500 mil. Then plus 10.
How is it plus?
Times 10 drops. All over 1 mil.
Please watch here. Watch the history. Remember what that if you have issues with ratio, proportion, and variation, you can never. In fact, you will keep having issues in FAMCA, even in practice. Even in practice, we have issues, and that is even more dangerous because human life are involved now. Please take this seriously. X is now what?
X is equal to 500 mil.
500 mil times what?
Times 10 drops all over 1 mil.
Good. All over what?
1 mil.
1 mil. So, which now what?
5,000. 5,000 all over 1.
5,000 drops. 5,000 what?
Drops.
Drops, good. 5,000 what? Drops. So, this heparin now, this 500 ml will we are moving this 500 ml now to drops first. So there will be 5,000 drops for over 10 hours. So 5,000 drops will be delivered for over 10 hours. That's the meaning. Which implies that 5,000 what? Drops will what? Deliver for what? 10 hours. Are we together?
Yes.
Now, but we are asked, this is drops in hours. Look up. Look up. So we're going to say drop per minute. So for us to find this is drops. If we bring this in down, we end up getting drops per hour. But we are asked to find drops per what? Minutes. Okay? So let's move this. Let's move this hours to minutes. If you move this hour to minutes, then we cannot find drop per minute. Let's go. Are you following? Are you following? How many hours? How many minutes make 1 hour?
60 minutes.
Huh?
60 minutes.
Good. So 60 minutes, okay, is equal to what?
1
hour. So how many minutes will make 10 hours? This is what? Yeah. How many minutes will make 10 hours? Good. Okay, so if we come apply, we have what? 60 minutes, right?
Yes.
Times what? Times what? Yes, so that I will follow you. Times
60
what?
times
10 what hours? Over what?
Over 1.
1
hour.
Don't get your unit, okay? 1 hour. Is that going to what? So cancel, right?
Yes.
So 600 minutes times 10 is what? So 60 minutes times 10 is what? 600 minutes. Are we together?
Yes.
So if we replace this 10 hours, the way we replace 500 mil with what? With what? 5,000 drop. So let's replace this 10 hours with what? 600 minutes. So we have that 5,000 what? Drops will deliver in what? 600 what? Minutes. Are we together?
Yes, sir.
Are we together?
Yes, sir.
This means that 5,000 drops will be delivered in 600 minutes. But the question says how many drops per minute? Look up. The question says how many drops per minute. So let's now calculate how many drops that will deliver in a minute. That's meaning per minute means in a minute. So we don't know how many drops, right?
Yes.
In one what? Minute. I follow you. Drops per minute means how many drops in 1 minute. The question says how many drops per minute. So how many drops in 1 minute? We already know that there are 5,000 drops in 600 minutes. So how many drops in what? 1 minute. I follow you. So let's find. Can I go in here?
Yes.
So let's find how many drops in 1 minute. So we have, so let's make S search the formula, right? So X is now what? Tell me.
Okay, and these two.
Say it now.
X is equals to 500 drops.
Is it 500?
Sorry, 5,000 drops.
Good. Times what?
Times 600 minutes.
600 minutes.
Over 1 minute.
Over what?
Over 1 minute.
1 minute. So minute to do what?
Cancel
minute. So we're left with 5,000 drops. No. You have misdirected me. And I was following you. What's going on? Do you have issue with this thing? I was just following you.
Okay, it's times 1 minute.
You have issue with this thing. What is your issue with it?
I don't have issue with it.
I know why I'm asking you. So this is 5,000 times what?
1 minute.
Times what?
1 minute.
1 minute. I was just following you, without even thinking that you are doing the right thing. Over what?
Over 600.
600 what? Minute. Thank you. So minute to do what?
Cancel minute.
So we now have 5,000 drops over 600. So simply divide 5,000 by 600. 20 will go, 20 will go. 50 divided by 60 will give you what? That should 8 point what? 8 points.
8.33.
Leave it at 8.33. Okay? Even though this is just for calculation purposes, in real sense, you can have 8.33 drop, but let's just look at that. Drops. This is 8.33 what? Drops. So what it means is that we have 8.33 drops will be delivered in what? 1 minute. Okay? That's the meaning. So from the answer, if you want to put the answer as you simply put the answer as what? 8.33 what? Drop per what? Minute. This is the answer. 8.33 drops per minute. Is it clear?
Yes.
Is it confusing? Okay. Fast, so we can go to the next question. You're done, okay. Okay, let's look at this question. Please, as I'm writing the question, we're writing it fast, so don't waste time. Okay?
Yes, sir.
Are you ready? Okay, the question says, a pharmacy technician is to fill a prescription for aminophylline 10 grain. This is grain, 10 grain. Full stop. Tablets are available in 500 milligram. How many tablets should the technician give? Now, look, let's try to understand the question first. A pharmacy technician is to fill a prescription for aminophylline. So the prescription that came to the pharmacy technician is tablet aminophylline 10 grain. Even though yes, this is not metric unit. This is imperial unit, common unit. It's not a metric unit, okay? Apothecary, apothecary, and the avalipua. You remember those ones, right? It's grain. Remember that 1 grain is how many milligram? I have 60 milligram or 65 milligram. When I ask you to use 65 milligram, remember. Alright, but you don't just look up first, and let's understand the question. A pharmacy technician is to fill a prescription for aminophylline 10 grain. So the prescription has aminophylline 10 grain. You see, this is the amount of aminophylline in the prescription. But the tablets in the shelf, remember the difference between what you have in the shelf, what the strength of the manufacturer, and the dose in the what prescription. Remember, this is the dose in the what prescription. But this 500 milligram is the strength in the what shelf. Remember that? Okay, good. Now, the question now says, how many tablets should the technician give? How many tablets should the what technician give? Now, for you to be able to solve this question, you need to convert this to what? Milligram first. Remember? Yes. So let's move this to milligram. Look at the question. The question says tablets, amino what? Phylline what? 10 what? Grain. Not gram. We are saying gram. So let's move this grain to what? Milligram. Remember that 1 grain is equal to, I say you use what? 65 what? Milligram for me, okay? 1 grain is equal to what? 65 milligram. So this, how many, if 1 grain is 65 milligram, how many grain will be in what? 500 milligram. Are we together? Or you can simply say, sorry, let's move grain to milligram. Let's move everything to what? Milligram. If 1 grain is 65 milligram, okay? So 10 grain should be how many milligram? We call it X. I don't think this is right. Please try to understand what I'm right. Okay.
I want to set it.
Do what? Check it.
Set the.
Okay, yeah, we're doing it. So, be telling you, tell me what to do here. S is not equal to what?
10 grains.
Times what?
65 milligram.
Over what?
Over 1 grain.
Over what?
1 grain.
1 grain. So, grain will do what? Cancel grain. So, how many milligram? 650 milligram. 650 what? Milligram. Good. So we cannot write this prescription in metric form. We cannot write this prescription in what? Metric form. Even though they didn't specify. Okay, it's tablet. The metric form is what? Is tablet. So we now have what? Tablet what? Amino what? Amino what? Phylline what? 650 what? Milligram. So we are moving to what? Metric what? Units. Now, but the tablets in the shelf is what? 500 milligram. How many tablets should the technician give? The tablet in the shelf is what? 500 milligram. And you are asked to give a patient tablet aminophylline 650 milligram. How many tablets will you give as a technician to the patient? If 1 tablet in the shelf is 500 milligram, but the dose is what? 650 milligram. What are you going to do? How many tablets are you going to give?
I'll give
2 tablets, okay. So will you leave the patient any instruction?
Yes.
So what will you tell the patient?
I'll tell the patient that's to 500 ml I give out.
Yeah.
You have to divide the other one
Into what? into four.
Okay,
if you divide it into 4, you have 125, right? So 125 plus 500 is now 625. But you are giving 650. So that you
going to power.
I was just going practical. You know, this is just a theory examination. You may see options. If you see options, so whatever you see in the option, maybe you may see 2. If it's theory exam, if it is essay, you cannot start saying all these things you're saying now. You tell the patient to use, maybe you can give the patient 1/4 or 1.5. Am I complicated? If it is essay question, but sometimes, in OBJ, you may still see 2 tablets, 3 tablets, 4 tablets. If you see such option, you can just give patient 2. I mean, because you may or may not have what you used to do to cut it. True of us, you may or may not have what you used to do to cut it. So, but as you in practice, as you give patient directive on what to do. Or if you have cutter, maybe if you have what you can use to cut it to that amount, you can cut it. But basically, you need to understand that if you now solve it and see what you will get, that the one in the shelf is what? 500 milligrams. So, but the one in the precision is what? 650. So what you now need that 1 tablet of aminophenol in the shelf contains how many milligrams? How many milligrams? 500 milligrams. So how many tablets will contain 650 milligrams? You now understand it? Yes. So this gives you what? X. So X is now equal to what? 1 tablet times what?
Times 650.
650 milligrams over what?
Over 500 milligrams.
500 milligrams. What's the answer? Just point it further. Let's find it in the decimal. 1 point what? 1 point what?
1.3.
Point what?
3.
Point 3 what? Tablet. Of course you cannot have 1.3 tablet. This 0.3 on top is something. So that's why you give. In fact, in practice, look up. Hope you know that you can see if you use 60 milligram here as 1 grain, here you get 600. Hope you know. So it now become 6. You have 625, 600, 625. So you just 25 milligram less than the exact amount. True of us. Good. But basically, in practice, in practice, you can the person can take 1 tablet, 1/4. If it is scored, you can easily break it along the line. You know, like score tablet. Then if you have a tablet cutter, you can cut this side. The person can take 1.5. It's okay. It's not bad. In practice, but because of say how many, if you want to give to the patient, you now give maybe 2. If you don't have what it takes to cut it, you give the patient 2, then tell the patient how to cut it and use. But if you can cut it, you cut it. But the exact amount is what? 1.3. Sometimes in exam you may see 2, 1/2, 2. You can take 2, no problem. Am I forgetting? All right. So, but it may not always be like that.
Okay.
All right. So that's the answer to the question. You're done. Okay. I'm looking for another question. Come on. Okay. Look at this question. This one somewhere you may see one of our 4 tablets. You can choose it, no problem. Okay? Depending on how the OBJ is 4, it can be twisted. But there are some figures you see, know that the answer is not there, but run away. Okay? Alright, so let's look at this question. It says, okay, the question says, you receive a doctor's order to prepare 0.5 kilogram of drug E. What is its equivalent in grams? You receive a doctor's, so the doctor's order, you have it, and what it says is that you should prepare 0.5 kilogram of drug E. What is its equivalent in grams? It's simply, they want to just another way of asking you to just convert this kilogram to grams. Simple. The same thing we did in grain, moving grain to milligram before solving. But here, it's another way of asking you convert 0.5 kilogram to milligram. So what's the answer? First of all, if you ask yourself how many milligram are in 1 kilogram. So how many milligrams are in 1 kilogram? You've forgotten. Alright, solution. There are 1 kilogram contains 1,000 grams. Kilo. 1,000. Kilo. Kilo means 1,000. So kilo. Remember kilogram. If you split this, remember when we did metric system, if you split this into 2, we have kilo separate. This is the prefix, this is the base. If you split it into 2, kilo and gram. So kilo as a prefix actually means what? 1,000. So if you replace this kilo by 1,000, you have 1,000 what? Gram. Is it clear? So 1 kilogram is what? 1,000 grams. So if 1 kilogram is 1,000 grams, so 0.5 kilogram is what? Is x. So x is now what? Yes, x is now what?
0.5 grams times.
Gram. What do I say?
X.
X is what?
X is equals to 0.5 gram times 1.
Is it gram? Look at the units. Be careful of the
Okay, kilogram. Jesus.
0.5 what? Kilogram times what?
Times 1,000.
1,000 grams. What about what?
1 over 1 kilogram.
1 kilogram. So kilogram will do what? Cancel kilogram. So we get left with 0.5 times 1,000 grams. What's the answer? Just half of 1,000 is what? Simple. 0.5 is half. Is what? 500. 500 what? So the answer is what? 500. The answer is what?
500.
500 gram. Good. Are you done?
Yes, sir.
All right. So let's go to the next question. The question says, under. This is two. The question says, under X suspension 400 milligram BID in stock X 200 milligram per 5 ml bottle of 200 ml. So question 1 says, so the question says, okay, I know. You are done, okay. The question says, order. Okay, that's what comes to the word pharmacy, right? Says X, they didn't mention the name of the drug. They just say X suspension. 400 milligram BID. BID means what? Eh? What are you saying? BID means what? It's not twice daily.
It's twice daily.
It's what? Twice daily. I don't understand. Now, so this is the order. What comes to the word pharmacy, okay?
Yes.
It says X suspension, 400 milligram twice daily. Okay? Good. But what they have in stock, please look up. Right? Let's understand this question first, before anything. But this is what comes in from the doctor to the pharmacy. Okay? But this is what the pharmacy have in stock. That same drug, the pharmacy has a bottle of it. And inside the bottle, we have 200 milligram of the drug X per 5 ml. So each 5 ml of what is inside that bottle is 200 milligram of drug S. But the entire volume of the bottle is what? 200 ml. So the volume of that bottle is 200 ml. But if you take 5 ml of if you take any 5 ml from that bottle, it contains what? 200 milligram of the what? Drug X. So this is what they have in stock. This is how the company packaged it. But this is the precision that entered the what? Pharmacy. Now, the question now says, how many ml are needed per dose? So for you to know what a dose means, of course you know what the dose means, the amount of drug what that will do what to achieve therapeutic what purpose at a particular point in time, right? Now here, this suspension is given 400 milligram twice daily. So a dose of that suspension, a dose of it is how many milligrams?
Sorry, 10 milligram.
What are you saying?
A dose.
Look at this prescription. A dose of this suspension is how many milligrams? If you are told to take a drug twice daily, take one tablet twice daily, a dose is how many tablets?
A dose is 2 tablets.
If you are told to if you are given a tablet, okay, let me use the one you know, perhaps from 1 tablet. You are told to take it 1 tablet 2 times a day. So a dose is how many tablets?
A dose is 1 tablet.
Then look at this place now. You are told that this suspension you should be taking 400 milligrams twice daily. A dose of it is how many milligrams?
It's 5 milligrams.
What are you saying?
A dose of it.
Where are you importing this 5 milligrams?
So, you know this.
Look at the question you are giving. This thing is what you are holding in your hand, though. From doctor in your hand, and you're the patient. It says X suspension, 400 milligrams twice daily. And then I'll call it. This is a dose of how many milligrams?
Oh, 400 milligrams.
Now you come. Which are they? So X suspension is 400 milligrams twice daily. So that means a dose of it is how many milligrams? 400 milligrams. Good. In the prescription, a dose is what? 400 milligrams of the X, right? Yes. Now, but we are asked how many ml are needed for that dose. That means how many ml of this suspension will deliver that 400 milligrams. Is it clear?
Yes.
Do you now understand the question? So how many ml? So for you to be able to determine, it's you that is pharmaceutical that will do this calculation. No? You see, did you see this is from a doctor? Did you see ml here?
No.
Is suspension, is it solid dosage form?
No, it's really solid.
It's you that will do that conversion by yourself and know how many ml the patient will take. So how do you not do the calculation? You only know that suspension you have in your shelf, 5 ml contains what? 200 milligrams. So if 5 ml of what you have in your shelf contains what? 200 milligrams of what? X. So how many ml will now contain that dose? Remember, it's a dose. How many ml will now contain? A dose is how many milligrams?
A dose is 400 milligrams.
So how many ml will now contain the 400 milligrams? That's the question. Do you now understand it? I should repeat.
So, yes.
Okay. You know where we got this 400 milligrams?
Yes, sir.
You cannot be writing one and repeating. Keep that place so you understand first before you write. The precision says give 400 milligrams twice daily. Am I communicating?
Yes, sir.
Good. That is a dose is how many milligrams?
A dose is 400 milligrams.
But what you have in your shelf
It's 200 milligrams.
is a bottle that contains 5 ml, which 5 ml for meat is 200 milligrams. So that means 5 ml contains 200 milligrams. How many ml will not contain the 400 milligrams? Because you want to calculate how many ml you will give to the patient will take per dose. So how many ml will it be?
The X equals to 5 times.
Stop throwing away your unit. It will deal with you, then you understand. Stop taking you only put your units.
5 ml.
5 ml times what?
Times 200. Sorry. So times 400. 400 milligrams.
400 milligrams.
All over 200 milligrams.
200 what? Milligrams. So milligram will do what? Cancel. We are left with ml. So let's go. 200 will cancel 400. Can you keep that calculator? It's not everything you behave calculator. 220 divided 400 is what?
200 divided 400 is 2.
It's 2. Oh yeah, you take calculator. 2. And 5 mil times 2 is what?
It's 10.
10 mil. Also 10.
10 mil. So, but you know that the first time I thought what my brain was telling me was my brain, when you were asking me that first question, that first time, my brain was just telling me this number 1, 10 mil. So I was thinking that with this number, how many mil are you needed that I needed per dose that you were asked. That was the reason why I was saying 10 mil.
Okay, so that means a dose of the drug is 10 mil. What it means is that if you open this suspension you have, if the patient takes 10 mil of that suspension you have, the patient is actually taking how many milligrams? 400 milligrams. So the answer to this one is what? 10 mil. Is it clear?
Yes, sir.
Good. Now the second question says, how many mil are needed per day? This one is simple. You should go to the category. So how many mils are needed per day?
It's 400 mil.
400
so,
mil.
20 mil.
20 mil, good. I like that. Good. Because the patient will take this drug twice a day. And the a dose, that means how many doses will the patient take in a day?
In a day is 20 mil.
How many doses now?
That means 400
doses.
Okay, 800
doses. How many doses will the patient take in a day? How many doses in a day?
2 doses.
2 doses, good. 2 doses. See now, 2 doses in a day. So if it is 2 doses and a dose is 10 mil, right? That means for a day is 2 times 10, which is what? 20 mil. Is it clear? So here is what? Simply do 2 times what? 10 mil, which is what? 20 mil. Good. Are we together?
Yes, sir.
Good. Now, let's go to the last question. Question 3. It says, how many doses can be taken from the 20 ml bottle?
200.
Sorry, thank you. How many doses can be taken from the 200 ml bottle? If a dose is 10 ml, okay? A dose is how many ml?
A dose is 10 ml.
10 ml. So how many doses can be taken from the 200 ml bottle? Set proportion and solve this. It's simple. If one dose is 10 ml, so how many doses will be 200 ml? Simple. This question doesn't even hear about the question said. Just for it to put down.
How many doses will be? Okay, 200 ml.
So how many doses? Is it 20 doses?
Yes.
Good. It's 20 doses, yes. Because one dose is 10 ml, right? So how many doses will be in what? 200 ml. So X is now equal to one dose times what? 200 ml over what? 10 ml. Ml will cancel ml. So we have 20 times 1 dose is 20 doses. So there are 20 doses. What it means that the person will take this drug 20 times. Hope you know. Then it will finish. Alright, so if you are done, let's go to the next question. I'm coming.
Yes.
I give you 1 minute to try this one. We've solved a question that looked like this today. I give you 1 minute to try it. Let's see what you can make out of it. The first question we solve is look like it's true of us. So try it, let's see. What's the answer? Is it solving?
It's solving.
Okay. What's the answer?
I want to.
Fast, 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 fast. Write down more questions so you can. Are you done?
I got 12,000.
12,000. How did you do? What did you do to get 12,000? How?
First of all, converted this.
Huh?
I converted this into
What?
the drops.
What did you convert?
1 drop equals to 10. Oh, Jesus. Oh, 1 gram. Oh, Jesus, what did I do? 1 mil is equals to 10 drop.
1 minute is 10 drop. Where did you get that one from?
So, then I know
Where did you get that 1 minute is equal to 10 drop?
that from the first question.
No, now this question is different now. Whatever you are doing should be with respect to this question now. Here, 1 minute is how many drop? Look at it critically.
1 mil is 20.
So why do you go back to that place? Please sub fast. No time to wait. Sub again. Let me see. This will make me to know whether you truly or understood what you did in the first place. I didn't say you should go and copy the first. I say that it's just a similar question with that one. That what I say. I didn't say you can copy the same thing there. Why I said let me write down more questions, so don't waste time. How did you get 400? Explain.
I did it like this. I think that's 1 mil. I meant 1 mil equals to 20 drops.
I agree.
Then I now said 20 mil is equals to X. I now cross multiply. Now make X a bit of formula. Then I now arrange 20 mil times.
Okay, just be telling me what it is so don't waste time. This one, you said you did what?
1 mil is equals to 20 drops.
20 what? Drops. Okay, I agree with you.
20 drops is equals to X. 20 drops. 20 mil is equals to X.
20 mil is equal to what? X. I agree. And S is what?
S is equals to 20 mil times 20 drops.
I agree with you.
All over 1 mil.
Over what?
All over 1 mil.
So what's the answer now?
Then mil cancel mil.
Okay, I agree.
I now got 400 drops.
400 drops. Okay, what next? Is it 400? Okay, I agree. What next?
That nothing else because they don't ask us for. They don't ask us for hour.
The question says, an IV will deliver dash got a mere drop per minute. So if you have that there are, so this means that we have that that 1 ml, that's this will now have that 20 ml is what? How many drops? 400 drops. 2 of us. That's many, right? Okay, now, so what next to do? Do we do?
X with 20 ml is equals to 400 drops. Then 20 X drops. 20 ml is equals to X drop.
You already got in 20 mil, that 20 mil has 400 drops. Why are you going back to
so
that?
Is that X, that dash there now? It should be X, you make it as X.
What you do is that you substitute this thing here now. You are told that 20 mil in 20 mil we receive 20 mil in 1 hour. So how many drops will they receive in 1 hour?
That is 20 drops. 400 drops.
Good. So this patient is used to receive 20 mil in what? 1 hour. So anyway, you see 20 mil. You replace it with what?
You replace it with
400 drops. So this means that the patient will receive what? 400 drops in what? 1 hour. That's the meaning. 400 drops in 1 hour. But we have 2 drops in minutes. So we convert this hour to minutes,
60.
which is 60 minutes, right? So we have 400 watts. So we have 400 drops in what? 60 minutes. We have what? 400 drops in what? 60 minutes. So if we have 400 drops in 60 minutes, remember we are calculating drops in one. How many drops in 1 minute? That's been on drop per minute. How many drops in 1 minute? That's meaning. So if there are 400 drops in 60 minutes, so how many drops will be in what? 1 minute. So what's the answer? So how many X will be in what? X drop will be in 1 minute. What's the answer? X is now what?
Well, X will be 400 drops times.
So X is now what? 400 what?
Drops.
Times what?
Times 1.
Good, 1 minute. Over what?
60.
Good, 60 minutes. So what will happen next? We need to cancel minutes. So divide 400 by 6. 400 drops by 6. How many drops will they give you?
By 60. It is 6.66.
6 point. Call it, leave it at 6.67 drops. Okay. So we have 6.67 drops. So in a nutshell, so we have 6.67 drops in what? In 1 minute. So if you put it in this form, it will become 6.67 drops per what? Minute. So what should be is what? 6.67. Is it clear?
Yes.
Good. Is this in clear?
It's clear.
Are you sure?
Is it this one?
Huh?
Yes.
Okay. So if you are done, let's solve the second question. You are done, okay? Alright, so this question, look up. This one says amoxicillin, because you know amoxicillin is a brand name, okay? Amoxicillin, 500 milligram per 5 ml. That's suspension, right? This is a prescription from a doctor. Amoxicillin, 500 milligram per 5 ml. 1 teaspoon, teaspoonful, Q8H. Q8H times 10 days, 10 d. Then that milligram of amoxicillin is to be dispensed. Everything is together, both the strength and the dosage are together, okay? There are some doctors that write like this. Some doctors write like this. They will write the strength. They will write, some doctors will just write the amounts, the milligram. Either this one or the exact amount is not wrong. But the one that is wrong is telling me amoxicillin 5 ml is wrong. But you don't even know the one they have in their shelf. I think I've said this in the past. But if it's like this, it's not wrong. In fact, this one says it makes the work easier for you, especially when if you have big strength. But you see what we did in the drug X. You just go 400 milligrams. I follow you. So yeah, but this one says 500 milligrams per 5 ml, 1 teaspoonful, pure 8H, 10 days. First of all, ask yourself, what is this Q8H? What is this Q8H? What does it mean? This Q means Bora. This means cure every 8 hours. Do you understand? This means every 8 hours. Every 8 hours. So if you have every 8 hours, how many hours are in a day? 24 hours in a day. And the abbreviation says every 8 hours. So how many times in a day?
Like 8 hours.
No.
Every 8.
There are 24 hours in a day. So
4 times in a day.
Divide 24 by 8. Keep that. Keep that. And 24 by 8 is what?
24 into 8.
24 divided by 8 is what? Don't touch that thing.
16.
How many 8s are in 24?
Size 10.
3 now here. So what this means, every 8 hours, that means in a day, 3 times in a day, right? Good. So you keep that one by the side, 3 times in a what? In a day. Keep it by the side, 3 what? Time. That's the meaning of this, 3 times a day. But it's for 10 days. This is the duration of the treatment. 10 days is the duration. This one is the frequency of administration. How many times in a day? Frequency. This is the duration, 10 days. Frequency, 3 times. This is the meal. Of course, 1 teaspoonful is how many meal?
It's 15.
5
meal.
5 meal. So here is what? 5 meal. So 1 teaspoon. I'm moving this thing back to I'm taking it to layman, the one you understand, you can use to solve our calculation. So this is 1 teaspoonful. So this is what? 5 ml, right? Good. So, but I must say the one they have in their shelf is 5 ml, 500 milligrams per 5 ml, meaning that 5 ml contains 5 ml of the suspension contains 500 milligrams of what? Amoxicillin. This is the amoxicillin. This is just a brand name. So inside that amoxicillin, 5 ml suspension contains 500 milligrams of what? Amoxicillin. Are we together? So now with this, we can solve this question. So here now we have this means if you open up this, it means that 5 ml of amoxicillin contains 500 milligrams of what? Amoxicillin. Amoxicillin is the drug product. It's not the drug itself. You know, is the medicine. Amoxicillin is the medicine. Am I competing? The drug products. But the drug inside is what? Amoxicillin. So 5 ml of amoxicillin contains 500 milligram of what? Amoxicillin. Good. Now with this now. But we are told the duration is how many days? 10 days. So we want to check how many ml, because the question says how many milligram of amoxicillin. I mean, as if they've changed to what? The drugs. So we don't know how many milligram of amoxicillin will be dispensed. That means the one that will be enough for that 10 days. So let's calculate for 1 day. First of all, how many ml? If the patient will take 1 teaspoon, 1 teaspoon 3 times a day. So how many teaspoons will it take in a day?
5, 1.
If the patient will take 1 teaspoon, leave ml now. The patient will take 1 teaspoon 3 times a day. So how many teaspoons will it take in a day? 3 teaspoons, right? So how many teaspoons will we take in 10 days?
That is 3 times
3
10.
times 10 is what?
Is 30.
30 teaspoons full for the whole entire drug and treatment duration. 30 teaspoons full. So how many ml are in 1 teaspoonful?
5 ml.
5 ml. So how many meals are now in that 30 teaspoonful?
5 times that's 300.
5 times that is 300.
No, sorry.
Is what?
5 times.
That is what? If you touch that thing, is what? Oh yeah, answer. Is what? 5 times 10. Okay, 5 times 3 is what?
5 times
3 is what?
15.
Then add that 0 now.
Okay, 1,500.
Eh?
It says add 0. I don't understand.
What are you saying? 5 times 30
That
is what? Okay. Keep this 0. 5 times 3 is what?
is 15.
Then put this 0 now. It becomes what?
150.
There you go. 150 in the palm of my hand. 150 mil. Okay, now. Good. So for the entire duration, how many mil? You are laughing.
150.
150 mil, right? Good. So now let us now solve the question. Hope you understood everything we've been doing here since.
Yes, sir.
We got that the person will take for the 10 days 150 mil. So let's now count it. We want to find how many milligrams that will be in that 150 mil. That's what we want to find out. So 5 mil contain of the amoxicillin contains 500 milligrams of what? Amoxicillin, right? So 150 mils of amoxicillin will now contain how many milligrams of amoxicillin?
To be X equals
X is now equal to what?
5 mil.
5 mil. We have
No, 150 mil.
150 mil times what?
Times 500.
Good, 500 milligrams. Sorry
5
about what?
mil.
5 mil. So mil will do what?
Cancel.
Cancel mil. So let's cancel 500. We have what? 5 divided by 500 is what?
Is
5 divided by 5 is what?
5 divided by 5 is okay. 5 divided by 5
Is what?
is
500 divided by 5 is what? Your time is going. 500 divided by 5 is what? What are you saying?
Like you have a reminder.
Hey,
So that is like
don't that. You should even be ashamed of your laughing. 500 divided by 5 is what? Five divided by 5 is what? Is 0.
1.
100 milligrams. So 500 divided by 5 is what? Keep calling Jesus. Now, let's go. So, mil has cancelled me, right? So,
Yes,
500 milligrams divided by 5 is what? 100 milligrams. So, 100 milligrams times 150 is what?
100 milligrams
Times 150 is what?
is 1,500.
1,500.
Sorry.
Is what? Is what?
It's 1,500.
Which is what?
which is 15,000.
Good. 15,000 milligrams. 15,000 milligrams. So the what here is what? 15,000 what? Milligrams. Is it clear?
Yes, sir.
So what should be is what? 15,000 milligrams. You must watch every like give me a method. 15,000 milligrams. Okay? Good. Alright, so let's go to the next question. Is there anything confusing here?
Yeah. No, let me copy the question.
Okay. You need a bigger calculator. The earlier you start solving with that calculator, the better for you because see, God has blessed us with a lot of things. Of these things limit you. You are mortgaging. You are thinking this thing. If you are all the time, you can carry calculator. The day it disappoints you, that means you can't do anything that day. Is that what you're telling me? Oh, please. Please. This is what calculator is doing to you. No, for real, it's not the laughing matter. It's what calculator is doing. Am I communicating?
Yes,
this is the effect of calculator. Alright, so if you are done, let's go to the next question. Fast, no time, fast. Let's go. One plus one, you can get 2 minus 1.
My brain was, when you asked me that, my brain was just saying, I'm not thinking anything.
Please start thinking something, please.
Because when you now get big and Rose and Angela, I can't remember that.
Please start thinking, please. I beg you, please start thinking. It's very important. Okay?
Yes, sir.
All right. Yeah, done. Okay. So let's solve these questions. I'll write down about 3 questions to solve it and see how far we can go. Okay. This is how many questions have you solved there? How many again? This is 7.
No, this is.
Give me your book.
I don't understand it.
Count it now. Count it. What are you doing? Count it. Let me know.
2, 3.
I want to number it. Number them. Serially.
5, 6, 7. 7. This is the 8.
This one is 8 1.
Yes.
This one now.
Yes.
Look up. This one is 8 1.
Yes. This one
Is 8 1. So this is number 8. So number 9. Are you sure?
Yes.
Okay. It's okay. It's okay. Let's not lose our time. Number 9.
Sorry.
Can you?
Is number 8. 7. This one.
This is 7.